Proactive risk management with 3M Prevena therapy aims to help advance the standard of care by helping to reduce the risk of costly postoperative complications such as infection associated with surgery in patients at high risk. In this video, you'll learn a few tips and tricks to support safe and effective application of Prevena therapy on a closed incision after a lower limb amputation procedure. Prior to use of Prevena therapy, consult detailed product indications, safety information, and instructions contained in the clinician guide. You'll notice that the hair has been preoperatively clipped to accommodate the area where the dressing will be applied. It is important that this area is clean and completely dry before application to ensure a tight seal. Once incision and peri-wound skin is clean and dry, apply 3M Cavalon No-Sting Barrier Film to peri-wound skin to prepare the area. To avoid tension or irritation on intact skin, use Prevena patch strips under the 3M Prevena dressing for protection. Avoid placing Prevena patch strips directly on the closed incision. 3M Prevena Restore Adaptiform dressing allows for customization with an expanded coverage area. Cut the foam dressing away from the incision to avoid particles from falling on the incision. To improve contour on challenging areas, cut wedges around the foam as needed. Place sealing strips on the white side of the foam at the top and bottom of the hourglass. For a larger leg, start with a wider piece of foam. If possible, have another clinician stabilize the limb. Hold the cut foam in place over the incision, assuring there is a gap on the sides of the foam to avoid circumferential application. When centering the dressing over the incision, ensure none of the sealing strips are touching the incision. Fold the foam over the incision area, folding it around the leg, applying even pressure to adhere the sealing strips. As you cut the drape, remember to allow for 1.2 inches of overlap when using multiple pieces of drape. Place the 3M vac drape on the posterior side of the leg with adhesive side up to facilitate a sandwich technique. If possible, have another clinician hold the foam in place as you apply the drape. With your Prevena dressing, it's important to run your fingers around the edge of the dressing when applying and make sure to avoid stretching the material. Do not stretch the dressing or film during application, as tension can cause skin damage, such as tension blistering. With your Prevena dressing properly placed and sealed, you'll be ready to connect the dressing to a 3M negative pressure therapy unit, getting your patient ready for mobile recovery. If there's evidence of a leak, use Prevena patch strips around the dressing to ensure integrity of the seal. If you'd like to learn more about proactive risk management with Prevena therapy, visit Prevena.com. For patient troubleshooting resources, visit 3m.com/Prevena for patients.